often do you think about your health? A lot? Sometimes? Hardly ever? How often do you go to the doctor? Us men certainly go to the doctors a lot less than women. In fact, we go over 30% less than women. 2% of us have never even been to a doctor. Ever. If we're certain there's something wrong, do we deal with health matters straight away? No. Once again, research shows that we procrastinate and tend to deal with health things next week. When it's really serious, surely we head straight to the doctors though, don't we? No. For example, only 65% of men would definitely consult a doctor if they experience chest pain. Statistics show that men are more likely to present with cancers when they're in an advanced stage. In fact, men are 40% more likely to die from a disease due to late diagnosis. Did you know men are actually twice as likely as women to be dead by the age of 65? Twice as likely as women to be dead by the age of 65. Do you drink too much? Of course, many of us blokes do, but is it really all that harmful? Alcohol consumed in moderation and within the guidelines is perfectly okay for most people. However, excessive alcohol use can lead to serious problems, including high blood pressure, heart disease, stroke, liver disease, and numerous types of cancer. Bearing in mind all this procrastination about health concerns, you'd think most men at least chat to their mates a little bit about their health. Very unlikely, unfortunately. Us men tend not to discuss our health, and if we do, it's in the very lightest of terms. So how often do we actually seek advice on our health? Men often tend to use pharmacies for health advice and are far less likely than women to attend NHS smoking cessation or weight management programs, for example. Most of us know that smoking can lead to conditions like lung cancer, but did you know that simply being overweight can lead to strokes and even cause some cancers? 2 out of every 5 people in the UK have high blood pressure, which is often due to their weight. In fact, a waist measurement over 37 inches increases your risk of health problems such as diabetes and heart disease. In general, it's been proven that men are 1.5 times more likely than women to die from heart disease, cancer, and respiratory diseases. So perhaps you don't smoke and you only have a drink occasionally, but be honest with yourself. Do you eat a healthy diet? Most of us could certainly benefit from less fat in our diets, along with more in the way of fresh fruit and vegetables. What about exercise? Do you get enough? Even a gentle walk 3 or 4 times a week can make a big difference. Just getting out in the fresh air regularly can make a real difference to your state of mind and your long-term mental health. On the subject of mental health, do you worry about things? Mind research has found that 37% of men are feeling worried or low, with the top 3 concerns being job security, work, and money. Research shows that men account for 75% of all suicides, and that 73% of people who go missing are men. Have a look at these facts on the 6 biggest risks to men's health. It's so important that we don't ignore all these things and risk living the last 10 years or so of our lives in relatively poor health or even dying prematurely. Keeping an eye on the calories, avoiding smoking, moderating your alcohol intake, and eating a healthy balance of foods and regular exercise really can help you to live a longer and happier life. So come on, let's make a change.